And there's another question about the public options. It's a little bit more on the political side. And you made clear in your views today before about where you stand on the public option and encourage the co-ops. And we've seen a lot of local opposition lately to that. And the huge majority of the American public still support the public option. And our question from Group 8 is, under these circumstances, why would you not yourself vote for the public option?
Well, I have voted for it in committee, and I would expect to vote for it again, except in a circumstance where, I mean, if the only bill we can get does not contain that, I would not expect to vote no on a bill that contains all of the other reforms that we're talking about, just because it did not contain the so-called public option. I think all of the polling about whether the public likes the public option, I don't know how much time they're spending explaining to people what's involved. As I say, I think there's a lot of confusion. A lot of people think that it's essentially the government's going to pay for health care, and that's not what is being proposed.
Group 9 is Rethink, Shadow Reynolds, asking about defining benefits.
Thank you, Senator Freeman and Heather. I'm Shadow Reynolds, and my question is, how and by whom will the level of preventive mental health and alternative medical services be defined?
Well, in the Health and Education Bill, which is the only one that we've gotten out of committee in the Senate, we directed the Secretary of Health and Human Services have an advisory panel that makes recommendations to her or to him on what should be included in the package of benefits, the basic package of benefits, and that then the Secretary is responsible for making the final judgment. She or he is not bound by the recommendations made, but they obtain the recommendations and then make the decision. And then, of course, Congress can override that if they disagree.
Thank you, sir. Group 10, what do y'all have to throw into this?
Good afternoon, Senator Bingaman. My name is Heather Himmelberger, and I'm representing Group 10. Our question is, there are various options such as co-op and the public option to lower costs. Using these and other measures, how will the bill ensure that the cost savings will be passed on to consumers rather than contributing to profits for private insurers?
That's a very good question. Well, the way I think about it, I think there are, when you look about costs in healthcare, there are sort of two big categories of costs. One are the costs that are a result of the fact that health care is being provided through an insurance mechanism, and that's what you're talking about, the profits and the administration of healthcare insurance companies. The other big category of costs is the cost of actually providing the healthcare services, and that's the providers themselves. There are great inefficiencies in both categories, in my opinion. And we're trying to, through this legislation, implement reforms that will take inefficiencies out of both. I agree with you that having some kind of a public option will be a significant contributor to causing healthcare insurance companies to keep their premiums down at a reasonable level. I think also having some kind of standard benefit package and having these insurance reforms in place will eliminate a substantial amount of overhead that's involved in insurance underwriting today. When I first got involved in these discussions on healthcare, I didn't understand the definition of underwriting. I thought underwriting meant sort of assuming the risk or taking the risk. It really means screening more than that. It means screening out the people you think might get sick and providing coverage to the folks who you don't and we would hopefully eliminate that as part of this reform.